Assalamu alaikum. Welcome to our online session. I am Dr. Nafisa Rashid, Professor of Pharmacology, Bashundhara Ad-din Medical College. Our today's topic is heart failure. Before going to start, I want to let you know that what is heart failure. We call a heart is failed when it fails to pump. That means it is a condition when the heart fails to pump adequately, and as a result there is inadequate blood supply and oxygen supply to the whole body. Now, what are the types of heart failure? It may be two types: high output failure and low output failure. And high output failure means the pathology is not in the heart, it is other side than heart. It may be due to anemia or beriberi or hyperthyroidism or pregnancy, and here there is no role of cardiac glycoside. And low output failure, that means heart muscle becomes fatigued and there is the cardiac outflow becomes less, and this is originally the pathology is in the heart. New York Heart Association classified the heart failure as 4 grade. Grade 1, there is no work and no dyspnea. Grade 2, dyspnea while walking on the flat surface. Grade 3, dyspnea while getting from the bed, and grade 4, dyspnea on the bed. Here, through these 4 grades, we understand that grade 4 is more severe case in case of heart failure. That is, the patient while lying on the bed, he feels dyspnea. And grade 1, if the patient works or if the patient has some exercise, then he feels the dyspnea. That is the low grade or grade 1 heart failure. Now, what are the consequences of heart failure? The consequences of heart failures are: number 1, cardiomegaly; number 2, tachycardia; number 3, edema; and number 4, there is dyspnea. Dyspnea means difficulty in breathing. Edema means excess accumulation of fluid in the dependent part of the body, and tachycardia is increased heart rate, and cardiomegaly means the heart becomes oversized beyond its normal limit. Now, what are the mechanism of cardiomegaly? At first, heart muscle fails to pump adequately, and at first stroke volume is affected, the stroke volume becomes decreased, and as a result cardiac output is also decreased. So, what is happened? There is increased residual volume within the heart, and increased residual volume causes size of the heart gradually increasing and leading to the beyond the limit of the Frank-Starling law. The law refers that within the certain limit the heart muscle contracts most, and if the heart muscle is beyond the limit of the normal size, it day by day it cannot forcefully pump. So, cardiac muscle cannot contract sufficiently, and further increase of the residual volume, as a result increase the size of the heart day by day, and as a result cardiomegaly. Then number 2 is tachycardia. Tachycardia means when cardiac output is decreased from its normal value, sympathetic stimulation from the brain is activated and increased heart rate occurs, and that refers to the tachycardia. Sympathetic system increases because the autonomic nervous system of our body causes reflection of the spontaneous sympathetic activity. As a result, adrenaline, noradrenaline releases excessively, and that causes increased heart rate. Now, how edema is occurred? Edema is occurred due to congestive cardiac failure, causes decreased heart rate and stroke volume, and as a result there is decreased cardiac output. As there is cardiac output decreases, there is decreased blood flow in the kidney, and decreased blood flow causes decreased GFR, glomerular filtration rate, in the kidney. And you know that when GFR is decreased, then renin-angiotensin system is stimulated, and there is salt and water retention. Salt and water retention causes excess edema. Now, how dyspnea occurs? Edema when accumulates water, excessive fluid in the lungs, as a result there is pulmonary edema. There is less gaseous exchange in the lung, and which causes dyspnea. Now, pharmacological topics is: what are the drugs that are used in congestive cardiac failure? Drugs that decreases both preload and afterload, that is the better drug, that is angiotensin converting enzyme inhibitor, angiotensin receptor blocker, beta blocker and spironolactone, and that only decreases the preload are diuretics, organic nitrate, and that only decreases the afterload calcium channel blocker and hydralazine, that is a direct vasodilator. And the inotropic drug or the drug that causes increased force of contraction are dopamine, dobutamine, phosphodiesterase inhibitors and cardiac glycoside. Today our main topics is cardiac glycoside. Now what is that? What is the type? What is the source? The source is plant in origin. Which plant? Foxglove. And which part? The leaves and the seeds of the foxglove. It is a non-nitrogenous compound and it is a sugar containing compound. The chemical nature is two type: sugar part, that is glycone part, and non-sugar part or aglycone part. The sugar part is responsible for its pharmacokinetic activity, that is absorption, distribution, biotransformation and excretion, and aglycone part is responsible for the pharmacodynamic activity. Now, how digitalis produces its action? At first, I want to show you a diagram, that is here there is sodium potassium pump and there is 3 sodium goes outside in response to 2 potassium goes inside the cell. This is the sodium potassium ATPase pump, and at first digitalis causes inhibition of this pump. As a result, there is sodium cannot go outside the cell and potassium cannot enter inside the cell. So intracellular sodium is increased, and when intracellular sodium is increased, it causes inhibition of the sodium calcium pump, and when it is inhibited, then excess sodium cannot go outside the cell and calcium cannot go out, and calcium increases inside the cell. So increases calcium, and also there is reticular system produces excess calcium. As a result, there is increased calcium ion in the cell, and we know that the calcium causes force of contraction, calcium causes actin myosin coupling and any type of contraction of the cell. So I can summarize that digitalis inhibit the sodium potassium ATPase pump, so increases intracellular concentration of sodium, and increased intracellular sodium causes inhibition of the sodium calcium exchange, so increased intracellular calcium. Increased calcium opens the voltage gated calcium channel, so there is more calcium enters into the cell. As a result, all this phenomenon causes cardiac muscle contractility. Now, what are the indications of digitalis? Digitalis indications are number 1, congestive cardiac failure, number 2, supraventricular tachycardia, number 3, atrial flutter and atrial fibrillation. On the other hand, the contraindications are ventricular flutter, ventricular fibrillation, heart block, constrictive pericarditis and also pericardial effusion. Now, what are the adverse effects of digitalis? This is an important for your professional examination, because it is a low therapeutic drug, so low therapeutic index drug, so it is not safer, and you have to be careful when you give digitalis to a patient, because it causes electrolyte imbalance. Now, we can divide it by 2 adverse effects. Number 1 is cardiac and another is extracardiac. Cardiac is bradycardia and ventricular flutter or fibrillation, and extracardiac are GIT problem, anorexia, nausea, vomiting. CNS problem may be insomnia, disorientation, depression. There may be eye problem, that is blurring of vision, photophobia, disturbance in the color vision or color conception, and others are gynecomastia in case of male. Now, what are the drug interactions? As it causes serum electrolyte imbalance, so there may be drug interaction. Which type of drug? Like thiazide, beta blocker, calcium chain blocker. When we give thiazide with beta digitalis, it causes digitalis toxicity. When we give beta blocker, it causes more bradycardia or heart block, and when we give calcium chain blocker, it causes digitalis toxicity also. In case of ion, decreased potassium and magnesium causes digitalis toxicity, and increased calcium and sodium causes digitalis toxicity. So, we have to regular investigate the serum electrolyte to understand the digitalis toxicity. If there is digitalis toxicity, what are the management? Management is stop the drug, potassium supplementation by potassium chloride preparation, potassium containing food like coconut water or banana, potassium sparing diet is like spironolactone. Now, that is all today. Thank you.